Denise, thank you for passing over the baton. Folks, as you'll see, Denise's message also plays out as part of my message. Denise and I met 2 years ago at the Society of Women in Urology annual meeting. She walked over and introduced herself to me. Her enthusiasm and curiosity were striking, and I knew this was someone with whom I wanted to stay in contact. Maybe that's where this story begins, with an introduction. My name is Amy Perlman. My preferred pronouns are she, her, and hers. I direct the men's health program at the University of Iowa hospitals and clinics. As Denise mentioned her role as more than playing the part of the Black woman in men's health, I similarly play more than the white Jewish woman who jams out to Christian rock in men's health. These identifiers are just part of a larger story and message, which is even larger than the topic of women in medicine, as one of several women highlighted in our institution's issue celebrating women in medicine 2 years ago. The article mentions that I find great strength in being a woman in a male-dominated specialty. I also mention in the article that I see my new role as more than just a physician, but also as an educator, an advocate, a learner, a researcher, and a mentor. This interview and article, if published in 2020 rather than in 2018, might have had an additional sentiment. And I just happen to be a woman. Now, being female in men's health and in medicine is sometimes important, and I did choose it for the theme of this presentation. Other times, it couldn't be less important, and I'm going to give you my perspectives on both. Over the next 10 minutes, we will consider a woman's role and experience in men's health as a specialist, advocate, mother, daughter, partner, friend, and educator, and understand special circumstances where being female may be helpful. I am a consultant for and receive grant funding from Boston Scientific and Endo Pharmaceuticals. I grew up in the state known for its crabs, and I currently live in the state known for its corn. In the middle, I had opportunities to train at a variety of institutions all over the country, including the University of Miami, Baylor College of Medicine, and the University of Pennsylvania. It was during my time at Wake Forest, however, with my fellowship director, Dr. Ryan Terlecki, where I developed my interest in men's health and sexual health. Observing him in clinic, I was able to witness and appreciate the value of really clear and concise patient education. He taught me how to meaningfully communicate to patients in clinic, perhaps the most important skill I learned during my fellowship. You should never be afraid to walk into a patient's room. Ryan Terlecki. His message was clear. You have all the skills you need to help your patients. Understanding pathophysiology, the evaluation and management options is particularly important when treating a population very different than oneself. In this way, as a woman in men's health, being a specialist means listening to my patients to understand their concerns, sympathy, despite not being able to experience their actual concerns, which would be empathy. I have 2 examples to illustrate this point. As a woman specializing in men's health, I know more about men's health than I do about my own, at least when it comes to female and male-specific health conditions. To put it simply, even though I've been a woman for 34 years, I understand very little about female-specific health. Most adult men I see in the office, and perhaps you've had similar experiences, have no concept of normal structure and function when it comes to their male genitourinary system, making it difficult for them to understand abnormal structure and function. Much of my time in clinic is spent educating men on the basics of their bodies, and these simple discussions set the foundation of trust that despite the fact that I do not have the same genital parts as they do, I can still understand and work to improve their symptoms. Think about all of the conditions we treat and how few of them we've actually experienced. Same concept here. The second example involves 2 men, one a patient of mine during fellowship who owned a honeybee farm, and I'll refer to him as Honeybee. His friend, whom I had never met, owned a butterfly farm, and I'll refer to him as Butterfly Man. So Honeybee tells me the following story. Butterfly Man says to Honeybee, "How can you go to a female urologist? What does she know about men's health?" To which Honeybee responds, "You own a butterfly farm, and last time I checked, you didn't have wings." 1 point for Honeybee and another for women in men's health. 2.5 years later, I'm feeling good about my specialty expertise. It's Wednesday morning, 8 a.m., and I am ready to rock in clinic, face shields and all. I pull up the electronic chart for my first patient and review his recent primary care doctor's note that states 26-year-old male presents for concerns for erection difficulties. Awesome, I can handle that. Discuss letting him discuss this with a urologist since they work with this much of the time and may have more suggestions. Yep, totally correct. Reassurance given, he reports he would like to discuss this with a man. So I wonder why he's on my clinic schedule and how he made it there in the first place. I check the appointment notes and read, patient okay with seeing female per phone call. All right, man, let's do this. And he's a no-show. The me 2 years ago would have been slightly offended. But then I think about my recent personal visit with a gynecologist. I preferred a female provider, and I would have thought it ridiculous if any of the male gynecologists were offended by that or thought they were better. They're simply different. It's great to have the luxury of choosing my provider's gender, just like we, as men's health or women's health or sexual medicine specialists, oftentimes choose the gender of the patients we treat. So instead of wondering why he didn't want to see a female and if this was the reason for his no-show visit, I wonder if he would have shown up if I had optimized my social media presence like Denise had spoken about. Perhaps if he had seen a familiar face, heard a familiar voice, and listened to my message beforehand, it would have made him feel more comfortable seeing a female provider. And I wonder, what does that person look like with whom he might feel most comfortable, and whose role is it to find the ideal provider for him? And perhaps how can we optimize social media to help him find that ideal provider? Which brings us to my role as an advocate, which for this 26-year-old male might be me finding a provider male who can meaningfully talk to this patient about his sexual health concerns. Or perhaps it means working with sexual medicine specialists like Ken Mitchell, Cynthia Benarchek, and Brad Hornberger to advocate for physician assistant and nurse practitioners currently working in or interested in doing sexual medicine. My current role is to advocate as a physician, not necessarily as a woman, for the education and opportunities for APPs that will allow them to work at their highest level of licensure. This screenshot of one of our Thinking Outside the Mask webinars speaks volumes. PA students, PAs, and Ps, new and seasoned physicians, talking about how we can best work together to treat the mutual patient. In trying to increase interest in men's health and sexual health among a diverse group of APPs, I'm advocating for that 26-year-old almost patient of mine to be able to see a provider he feels comfortable seeing. And that starts with educating current providers and students. I started a men's health PA 2-week rotation a year ago, and after working with several motivated PA students, I am optimistic that our field of men's health and sexual medicine will continue to improve when it comes to being able to offer specialized, streamlined, and accessible patient care. While my job is to treat the male patient sitting 6 feet away from me in the office, I am also an advocate for his partner. Let me give you an example. A patient of mine, for HIPAA's sake, we will call him Mr. Smith, came to see me for erectile dysfunction and elected to proceed with penile implant surgery. He canceled his surgery last minute on 2 occasions. So when he called back to reschedule for the 3rd time, I had him scheduled for an office visit to rediscuss his situation. I had never met his wife prior, but he brought her to this clinic visit. I looked at Mr. and Mrs. Smith's facial expressions, much easier to discern pre-COVID, and Mr. Smith appeared anxious to get his penile implant surgery rescheduled, whereas Mrs. Smith appeared anxious. You don't seem particularly excited about your husband getting a penile implant. Can you tell me more about that? I asked Mrs. Smith, to which she responds, he has many medical problems, so I worry about him having surgery. Also, I'm not interested in having sex. I look over at Mr. Smith and pose the simple question of, did you hear what she just said? To which he responds, yeah, but once I have a penile implant, that will change. I took a figurative step back, put my woman in men's health advocating for the female partner hat on and said, Mr. Smith, that is not how this works. So in this scenario, I wonder, what would have happened to Mr. and Mrs. Smith's relationship if I had proceeded with penile implant surgery? Would Mrs. Smith's interest in having penetrative intercourse have magically appeared? Or might this have led to sexual assault, divorce, unmet expectations, a combination of the above? Outside of being a woman in men's health in the healthcare setting, there's also the woman's role in men's health outside of the healthcare setting, which means asking questions like, what is a woman's role in men's health when it comes to a mother and her son, a daughter and her father, a woman and her partner, and a woman and her male friend? I wonder, do we even consider these various roles, let alone define them? I set out to answer these questions, or at least to pose them. Iowa City, Iowa, circa 2019, topic, a woman's role in men's health. Attendees, 5 women in the local community with whom I never met, one of whom was hosting the event, the wife of a friend of a 70-year-old patient of mine who initially saw me for erectile dysfunction. I posed these questions to these women, and here were their responses. We take care of our own health, men should take care of theirs. Women have to be very sensitive about bringing up concerns. Some men share too much and it turns people off. Mothers assume their daughter-in-laws will take control of their son's health. My husband talked to our son about his health. Are you surprised by these responses? Do you relate to any of them? Are you grateful, like one mother, that your son has a wife so that she can navigate the healthcare system for her husband, also your son? Or do you assume that, like another mother, that your husband talked to your son about his health, but when asked if he actually did, you actually wonder if he did? Unsure of what to think? Welcome to the club. These responses made me wonder, what would happen if we sat down with our loved ones and discussed our roles in their healthcare? What would it take to do this? Would it encourage each of us to seek help sooner from a professional with the expertise and the interest in providing helpful and useful information? I'll wrap up with my role as an educator when it comes to trying to engage and educate our patients and community members, especially when they look different than us, whether a different age, race, and or gender demographic. It's really helpful to ask for help from our patients who can facilitate a safe space for other attendees. I recently participated in a Facebook Live event during Prostate Cancer Awareness Month, during which time I interviewed Herschel. It was Herschel, prostate cancer survivor, who spoke about his journey post-prostatectomy with various treatments he tried for erectile dysfunction and urinary incontinence, who made me relevant in this discussion. And despite that Herschel and I are very different in age, race, and gender, we learned some things from each other and had a great time in the process. As a woman in men's health, most of the time, I am educating and advocating for people who look and think very differently than I do, which can lead to a very powerful message. One that says, despite our differences, I hear you, you are important, and so are your concerns. Sometimes our patients express a similar sentiment about their healthcare providers, and a patient recently wrote, Dr. Perlman, just a note to say thanks for your evaluation and explanation understanding of my medical issue you and your resident helped me with last week. Interesting, strange how comfortable you two made me feel in a situation most men, self included, would feel very uncomfortable. Male urology patient, female doctors. Kudos. Thank you so much for your time. Kudos to you all.